Hi everyone, it's Dr. Jeff from Kelowna Family Chiropractic and the 100-Year Lifestyle. Today I want to talk to you a little bit about back pain. Research shows that over 85% of the population suffer from back pain on a regular basis. And back pain is one of the most common reasons that adults tend to visit the emergency room and miss work. So let me start with a little bit of a story. This is one of my patients. I had a patient whose name was Marlene. She's been a patient of mine for quite a while, and she was telling me a lot about the struggles that her mother had been having. Her mother was having very, very severe back pain. She didn't want to entertain coming to the chiropractor, even though her daughter and her daughter-in-law and her grandchildren had all been coming to the chiropractor and having great success. She was pretty sure she didn't want to go. Her doctors told her it probably wouldn't work. She was just full of arthritis and deterioration, and really there was nothing she could do but try to take medication to manage the pain. She definitely got to a point where, she really didn't want to go on much longer. She was having so much pain, she couldn't do anything. She still was living in her own home and was really, really suffering. Well, ultimately Marlene finally talked her into coming in, and her name is Elizabeth. Well, when Elizabeth showed up at our office, Elizabeth is 92. She'd never been to a chiropractor. She came in with her daughter on one arm and her daughter-in-law, or her granddaughter-in-law, on the other arm, and a walker in the middle, and they basically carried her in, and she was so hunched over she could hardly lift her head up even to make eye contact. Getting her on the table to do the exam, she was shrieking in pain. She was in severe, severe pain. So basically, once we ran her through the exam and we did her nerve scans and looked at her posture, went over her health history, we decided that there was a good chance that we could help her restore a little bit of her mobility. And so what happened over the next few months was really quite remarkable, even in my eyes, and I've been doing this for 24 years. Over the course of the next 6 months, she started with 3 treatments a week. We did that for a couple of months, then it cut it back to 2 times a week, then to 1 time a week. Her posture went from hunched over to almost completely vertical. Now, she's 92, so she still needed to walk with a walker for balance and things like that, but now she walked into the office, she has a smile on her face, she gets on the table without any trouble, she has her treatments. Now she comes in about twice a month, every 2 weeks for a little tune-up, gets off the table, and leaves with a smile. This has totally changed her life. She still is able now to live in her own home, take care of herself, and she's excited to get out of bed every morning. That's what's possible when we let the body heal itself. So how is this possible? It's all related to posture. Okay? It's not a secret, that every single thing in the body is controlled by nerve impulses from the brain, down the spinal cord, out through nerves. Stuff goes on in the body and then nerve impulses are sent back. When the posture deteriorates and changes and you start to lose those spinal curves and get hunched over, what starts to happen is those nerve impulses start to be affected, and it can affect everything related to your health. And this is really what the 100-Year Lifestyle is all about. It's about making healthier choices to live a healthier life. By restoring a little bit of that posture and some of those normal curves, the nerves started to work better and her body started to heal and her function totally improved. And that's what the 100-Year Lifestyle is all about. It's the way in which we increase longevity. And I'm very hopeful that Elizabeth is going to be one of our first patients, our first patient to actually reach 100 years of age. Thank you for listening. I have a little gift for you for spending a few minutes with me. What you can do is there's going to be a link below this video. If you click on that link, we're going to let you download the posture test that we use in our office, and this is something you can do at home to check your own posture and check the posture of your family members or even any friends. And if you find some things in the posture that are a little bit off, maybe there's a reason to come in and see us and have an exam done and see if there's something we can do to help improve your posture, and if maybe some of your health issues, whether it's something like back pain or whether you might have some other health issues that could be coming from your spine. This posture test will help give you. So, don't be crisis oriented. Don't wait for that posture to deteriorate to that point before you decide you need to have attention. Don't let that health deteriorate to where again you're in crisis mode and now you seek attention. Work in a preventative manner. Work on that posture. Get that spine checked on a regular basis, because that spine and nervous system is the foundation for health, and you will live a healthier life. Thanks for listening. As always, if you ever have questions, you can send me a message on Facebook or you can call the office and I'd be happy to call you back. I'm Dr. Jeff from Kelowna Family Chiropractic and the 100-Year Lifestyle. Live yours. Talk to you soon.